Hello everyone, in this video I will demonstrate the insertion and removal of an intrauterine device using 3D animation. The procedure starts with a bimanual examination to determine the size and the position of the uterus. Wearing non-sterile gloves, the uterus is palpated using bimanual vaginal and abdominal examination technique, with the non-dominant hand palpating just above the symphysis pubis. Now, a self-retaining speculum is lubricated and inserted inside the vagina, and the cervix is inspected for any discharge or other macroscopic abnormalities. If cervical abnormality has been determined, high vaginal and endocervical swabs should be taken and the procedure should be terminated. And if indicated, the patient should be assessed by colposcopy. The vaginal fornices and the cervix should be cleaned using an antiseptic solution. The anterior lip of the cervix should be grasped using tenaculum forceps. Fraction is applied to straighten the uterine canal, and if the uterus is retroverted, fraction should be applied to the posterior lip to straighten the canal. The tenaculum forceps must remain in position to stabilize the cervix, and gentle counter fraction should be maintained with the non-dominant hand throughout the insertion procedure. And we can apply local anesthesia to reduce cervical discomfort, or on occasion a paracervical block can be used. Now, the depth of the uterine cavity is measured using a uterine sound. An IUD should be generally not inserted if the depth of the uterine cavity is less than 6 centimeters, and the specific manufacturer's instructions should always be consulted. And in some cases, we may need to dilate the cervix using a dilator before we insert the IUD. The IUD is prepared by sliding the knob forward from the mark of the holder of the inserter. This will draw the IUD completely into the insertion tube. The flange is positioned at the point on the scale on the insertion tube, corresponding to the measured uterine length. The insertion tube is inserted into the cervix and advanced into the uterus until the flange is 1.5 to 2 cm from the external os. Hold the inserter steady and pull the knob on the holder back to release the arms of the IUD. After waiting 5 to 10 seconds for the arms to be open, the inserter is advanced gently into the uterus until the flange touches the cervix. This will position the IUD in the fundus of the uterine cavity. The slider is then pulled downward while holding the inserter in place. Now the threads will be released. The insertion tube is then removed. The threads of IUD is trimmed using scissors, leaving 2 to 3 centimeters of the threads visible outside the cervical os. The speculum is removed from the vagina. Now, the removal of the IUD. It can be removed using forceps to grab the threads at the external os and applying fraction to remove the IUD from the uterus.